Welcome to Raw Take, everyone, the lifeline to your unfiltered media experience. Before we start the show, don't forget to like, comment, and subscribe if you're watching on YouTube. And if you're watching on Facebook, go ahead and like the channel. I'm your host, Gion Thomas, and this is my co-host, Archie, and this is a special live stream COVID edition. We're going to have two lovely people on from the Houston Department of Health. Right now, we have Brandi, who is the Houston Health Department Community Liaison, and later on in the show, we're going to have Rose Ruth, who is the Houston Health Department Public Health Nurse, and they're here to answer some questions and inform us about COVID-19 and the new Delta variant and all of those topics, and tell us about the vaccine and just kind of get rid of some of the conspiracy theories and the misinformation about COVID-19. But before we do get into the show, Brandi, tell us a little bit about yourself and what you do.
So I work at the Immunization Bureau of the Houston Health Department, and I'm able to go out into the community and talk to people about usually routine vaccines like childhood vaccines, flu shots, those sorts of things. But now I'm also able to assist with COVID outreach and COVID response to try to help make our community safe and protect our community members. And thank you so much for having me today. I appreciate y'all for having us be able to come and share information with everybody.
Absolutely. Oh, definitely, absolutely. It's definitely needed because there's so much misinformation coming about COVID-19 and the vaccines in general. So you work more on the side of reaching out to the communities. Do y'all host like events to get people vaccinated and things of that matter?
We do. We partner with different organizations that have mobile clinics to go out into the community and vaccinate where people are. That's for routine vaccines and our usual schedules. But right now, we also have a whole branch of the health department that goes out and does strike team COVID clinics as well. So you might see them one day at a church. You might see them one day at a restaurant, just wherever they can find people living their regular everyday life.
Wow. So they're called COVID strike teams. And so they just kind of go out to where there's probably high populations of people and go there to try and get them to get vaccinated.
Right. So if you're going to be playing basketball at the park, you might see them Saturday, or if you're going to be out with your kids at a museum, you might see them there. They are a variety of different places to try to make this accessible to everybody so that people don't have to even think about getting out of their regular routine. It's so important that we just want it to be readily available to everyone.
Yes. So one of the questions I have is, what are do you have the numbers or the rates of young people getting vaccinated?
So we get every week different updates with different numbers and percentages. And so we've noticed that there's a younger population of people who have been eligible for vaccines for a while but haven't been vaccinated. So we recently, over the last month or so, have been able to vaccinate children all the way as young as 12 years old with the Pfizer vaccine. And so we're still working on those numbers. We're around 30% of those kids having their first dose. But we have approximately the same percentage of people from 16 to maybe 25 still in that same vaccination range, but they've been eligible for vaccines since December. So we are trying to make sure that we reach out to every age group of the population to make sure that they all know that they're important and that it's not only important for their own safety, but safety of the people that they come in contact with, because we were very excited that we're in the high 90s of vaccination rates for our 60 plus population, which is a group that is at a higher risk of severe outcomes from COVID exposure. And so when the vaccines first came out, we really targeted that population pretty hard and made sure that we were available to that group of people. And so those numbers are really encouraging to us.
Okay.
Yes.
What about the number of people that has gotten COVID? You know, like the young people, because right, like right now, a lot of people are not getting vaccinated because of things that they're hearing from whatever the sources they're hearing it from. So, how is that affecting like people as far as like how many people are getting who are catching COVID right now? Do you have any numbers on that?
So I know that yesterday for Harris County, our threat level was raised to red, and I saw in one of our health department newsletters today they monitor some of the positivity rates by checking our wastewater system. That allows them to be able to see the prevalence of the virus in certain communities based on their plumbing systems for the city, right? And so they showed the positivity rates on a map, by how red that area was in July of 2020 compared to the end of July this year. And the rates were higher than this time last year when we didn't have a vaccine. And so something that is scary about COVID, for as much studying and research and information that we've been able to gather, something we still are studying is why it affects people differently. So some people get infected with COVID and they're asymptomatic. They have no signs of COVID at all. And some people just get kind of mildly ill, or they feel bad for a few weeks. But some people have a really severe response and are hospitalized, and it sometimes leads to death. And the fact that we don't know why that happens for different people, we do know that there are certain populations that are a higher risk of a severe outcome. But this really can affect anybody in a severe way. And that makes it extra important to get vaccinated, because you don't want to just really run the odds. And when the positivity rates are so high, like they are right now because of the Delta variant, it spreads more rapidly than the original COVID virus did. And it's reaching more people, and it's more highly contagious. And so we don't know how, as individuals, we'll respond to being infected with COVID, and that makes it even more important to get vaccinated as soon as possible.
Yeah. What would you say to someone that says, "Well, I don't have COVID. I haven't caught it all this time, so why should I get vaccinated?" What would you say to someone that says that?
Well, I would start by saying that's fortunate for them, and that I'm very glad that they haven't had to suffer with COVID. But I would also tell them to be mindful that because you didn't have COVID yesterday doesn't mean that you won't be in contact with COVID tomorrow.
Mm-hmm. Okay.
Brandi, I have a question. It's about the Delta variant, and you said that more younger people are being more they are more infected due to the Delta variant. How many different variants of the coronavirus is there? Like, how many different variants have we seen throughout the pandemic?
I would have to look into that to be sure. I would hate to misquote something. But I do know that we've had two pretty significant strains, but that also I think Delta means 5.
Okay.
And so I also was advised by one of my coworkers that she read an article that said in another country they've already identified what they called a Delta plus virus, which means it's the Delta variant, but it's a little worse. So what happens with virus variants is that the longer they're allowed to circulate, their job is to survive and spread, right? That's what they exist to do, to infect more people and last longer. And so as some people become resistant to it, or as the population gets less ill from it, if it's still allowed to circulate, it's going to learn how to adapt and change so that it can continue to survive. So if we would get vaccinated so that it can't continue to spread, it wouldn't have an opportunity to grow and change and create the next variant of it that may be more significant or more dangerous. So getting vaccinated now in a wide population kind of way for a herd immunity, a community immunity, is important to stop the virus from continuing to mutate.
Wow. Okay. People today, like, I guess everybody's pretty much aware of COVID, but it seems like a lot of people are getting mixed messaging, and it's causing people to not want to get the vaccine. So there's a bunch of theories, conspiracy theories out there about the vaccine, that it contains nanotech and all of these different things that people are saying about it. So what could we say to, like, those people who are getting misinformed, that with these all of this different information is causing them to not want to even consider getting the vaccination? Because like, the more people that doesn't get vaccinated, the more probability of this thing spreading. And so we need to have a messaging for that, because it seems like on the other side they have all this messaging saying that the vaccine is this, that the COVID vaccine is that, you shouldn't get it. So we need messaging saying why you should get it.
Well, I think that and we talked about this the other day, and you made such a good point that we're in a time of social media, and the things that seem to last the longest on social media are the most sensational things, right?
Yeah.
And so it's not necessarily the most true thing. It's the most entertaining thing usually.
Right.
And so I think that sometimes works against us in our decision making. And I really would just like to encourage people to be empowered about the decisions they're making, and look at other options for information. So, for instance, you could just do a simple Google search that says CDC myths and facts, and it'll bring you to a page on the CDC website that has all kinds of information about common myths about the COVID vaccine and the information that goes with that myth, the accurate information that goes with that myth. And so I would just really encourage people to make sure that they really vet the source that they get their information from, and make sure that that information is reliable, and especially consider making sure of that before you share that information or spread that information to other people who are important to you, and who you want to keep safe and protected from harm. You want to be sure that you're giving them safe, healthy, accurate information.
Yes, yes. Along the lines of misinformation, people will say that this that the vaccine will mess with your mRNA. Can you tell us a little bit about that, Brandi?
Sure, sure. So mRNA messenger, I apologize if I'm too still in this room, the lights go out. Sorry about that. Surprise. mRNA stands for messenger RNA. That's something that naturally exists in us already. It's what tells our cells what job they're going to do.
Exactly.
And so mRNA is a natural product that we already have anyway. The concern is people feel like mRNA is so close to DNA, just in the sound of it. People sometimes feel like the mRNA is changing their DNA, but it doesn't. So for our mRNA vaccines, what they do is they tell our cells to make the spike protein that mimics the spike protein on the COVID virus. So our body makes that spike protein. Our immune system recognizes it's not supposed to be there. and it builds antibodies to block them. And then if we come in contact with the COVID virus, it recognizes, our immune system recognizes those spike proteins, and keeps us from being sick from the virus. So mRNA interacts with your cell, but never goes into the nucleus of your cell. It's just not able to do that. And that's where you keep your DNA. So it doesn't have the ability to affect your DNA.
Okay. We have Miss Ruth on.
Okay.
I'll go ahead and add her to the stream.
Oh, hi, Rosie.
Hello, Rosie.
Hi, how are you?
It's great to have you on. It's so great to have you on, and we are very looking for your insight. We were just talking about the RNA part of the vaccine, and because there's a lot of misinformation, and Ms. Brandi was talking about how the RNA it sends the information, and how it she was talking about how it creates a. Can you say that again, Ms. Brandi? I don't want to misquote you.
And that's okay. I was just talking about how mRNA tells our cells to make the spike protein that mimics the spike protein on the COVID virus, and that triggers our immune system to build antibodies to recognize those spike proteins if we become infected with COVID. And we were also talking about how the mRNA doesn't enter the nucleus of your cell where you keep your DNA, so it's not able to alter your DNA.
She's right. So I always tell people when they ask about the vaccine, and in this way, so what it does is it tells your body what to fight against. So it's like if you have someone coming to your house and you don't know who it is, you won't let them in. If you have someone that comes to your house and you do know who they are, but you don't want them to go to certain rooms, this tells you what not to fight, what not to let in. So I always use a joke and say, my daughter won't let anybody in our house unless we tell her to let them in. She can look at you through the window and you can say you're who you are, but she's not going to let you in the house. So the same thing that the vaccine does. It knows what the COVID vaccine, what the COVID virus looks like, and it knows not to let it in. And another layer to it, that's why some people, when you get your second vaccine, you tend to feel kind of weird because you've built up your immunity and it knows what the virus looks like. So when you're reintroduced to it with your second vaccine, you feel symptomatic because your body is building up a fighting mechanism because it's been exposed to something that looks like the COVID virus. So I tell people when you feel weird on your second vaccine, good job, because that means your body is doing what it's supposed to do.
Okay.
Wow.
That's
and
good to know.
That makes a lot of sense. That makes total sense. So we were talking about the need for the vaccine. Why is it so important for younger people to get the vaccine? Younger people will say, I'm as healthy as an ox. I barely get sick. And yes, I know it's to do the herd immunity, but to people who say, well, I don't trust the government or trust things of that matter, how do we talk to those people?
So like for me, I have 3 children and a husband. My husband is vaccinated. I'm vaccinated. My middle daughter is vaccinated. My oldest daughter is vaccinated. But my 6-year-old son can't get vaccinated. So we're vaccinated because we don't want to get him sick. He can't. So we can get the immunity and build a wall around him. This is one, like you said, for herd immunity. It is to necessarily build a wall around the people who can't get the vaccine right now. So that's 1. 2, it's to build a wall for the people who, for your elderly community or your immunocompromised folks that still can either maybe not get vaccinated or haven't gotten vaccinated, but they're elderly and maybe they can't get to a hospital or a doctor. You would hate to bring someone, the virus that way. Yeah. And then lastly, what we need to make sure is that I don't know where people think that healthy people can't get sick and die. because they can. I can get the virus. Anybody here who's not vaccinated can get the COVID virus and die from it, or be permanently harmed. I've had nurses who have worked on my team that are healthy. No, they didn't die, but they have permanent harm. They have asthma. They have a hard time with elevated heart rate going up and down stairs. Like, some people need to understand that the worst thing may not be that you die, that you are on dialysis, that you have permanent harm to your lungs or permanent harm to your heart. If you could prevent that by taking a vaccine, why not? Or nothing can happen to you, right? You could be exposed to the virus, catch it, and nothing happened to you last time. And then the Delta variant comes and mutates, and then you get really sick. Like, if you could just not get sick, why would you?
Right. One of the things that we know that people are saying a lot these days, I know some people personally that said this, is that the vaccine is killing people, like giving people COVID and killing people.
And it doesn't have it. So there's two types of vaccines, and I think I heard Brandi talk about this earlier. So this is not a live or weakened version of the vaccine. It is a built vaccine that helps kind of mimic the DNA or RNA strands of the vaccine. So no, if unfortunately you had someone that passed away or had some issues with the COVID vaccine, it probably wasn't because of the vaccine. It's probably because of some underlying medical conditions that they had already.
So I actually had that question from a person in a presentation I was doing yesterday for Head Start teachers. She said that one of her relatives had been vaccinated and still got COVID and passed away. And of course, we sent our sympathies to her because that's a terrible outcome. But it happened recently, which led me to believe it's very possible that that was from the Delta variant. And also, I didn't ask her about this personal information in front of 150 people that we were talking to, but I told her hypothetically, without knowing the personal information about that person, if they had a compromised immune system, if they were not able to build a full immune response because they didn't have a spleen or because of certain medications they were taking, they might not be as have as much immunity as somebody else would. If they already had a heart condition, if they already had a lung condition, if they already had kidney problems, they might also have a harder time beating off that Delta variant if they were infected with it. And so when you talk about herd immunity, we hear that a lot, and not a lot of people really understand what that means. And what that means is if everybody but one person in the room with me today is vaccinated, the person who couldn't be vaccinated or couldn't develop a strong immune response is protected by all of us who were vaccinated. The virus cannot spread from that person outside of the room across all of us vaccinated people to that unvaccinated person. So the term herd immunity or community immunity really refers to the ability of more healthy people to get vaccinated and protect the safety of people who may not be quite as healthy or might be more high risk.
Right.
Yeah, and to kind of add to that is what we want to do is the more people and that's a good thing about having more than one type of vaccine, to have it meet kind of the need of what your body can handle or should handle. And I think another thing that we have a misinformation is people really don't understand the intricate science that goes into creating a vaccine. They think it was just built last week and then it came out. That's the number one thing. They're like, well, they just came out with this. Well, COVID isn't even a new virus. It's just a pandemic now. I worked in critical care, and one of the things that I have to tell people is we I dealt with people that passed away from the flu. We had a really bad flu strain down. So we as public health officials really just want people to be vaccinated from all things that can be prevented. So and I understand the distrust in the government. But which is why I think it's super important and really great that a lot of our public officials have gotten vaccinated on camera in public. That matters. Sometimes you need to see your leaders get the vaccine. When they vaccinated us here at the health department, I wanted to give my spot away to one of my nurses. But then I realized that they needed to see me get vaccinated. They needed to know that I wasn't going to take anything in my body that I wouldn't want them to take. So, I've vaccinated my team members, and not everybody got vaccinated in December when it was first available for us. Some people really had to wait. I had a young male that didn't get vaccinated until April, but he got vaccinated, and he in working in this operations made him see the necessary and the need for it. He wanted to protect his family.
That's really similar to my story. It wasn't until everyone around me was getting vaccinated, and unfortunately, I had a friend pass away, and I was like, "Wow!" Like it hit so close to home. I was like, "Yeah, I'm getting vaccinated." And so we've been talking a lot about herd immunity. What is the percentage of people do we have to have vaccinated for us to get to a herd immunity, so we don't continue to have these different variants popping up? Because as we have people not getting vaccinated, we just have these variants popping up. And so what is that? What percentage of people need to be vaccinated so we can have herd immunity?
I want to say 70%, right?
Yeah, we're going for 75%, but even when we reach that percentage, there's never too many vaccinated people. So I hope that we reach that point soon, because that is a target. But 90, 95%, 100% vaccinated, that'd be great.
Yeah,
it would be. And we've done it before. So like most of our probably I'm 40. So like my parents' generation got vaccinated for smallpox. So I tell people all the time, we don't worry about smallpox anymore. So this has been done before. It can be done. And they didn't have the technology we have. They didn't have the accessibility, the population, the information, and the intelligence that we have now. So we should be able to knock this out of the park.
So another question people will ask, well, the vaccine is not approved by the FDA. How do we fight against that?
Well, it did get emergency approval, and I want to say Pfizer is petitioning for full approval. And everything takes a process, and you really want something to go through all of the procedures for the safety mechanisms for the community. Doesn't mean it's not safe right now, but because we were in the middle of a pandemic, we had to move for the priority to take care of our community. So it's not that it's never going to be. It's just that it is a process, and that process. And then think about it. We're in the pandemic. There's a lot of people that weren't at work. we had to get them vaccinated to get them back at work to get that process done.
And so when we started vaccinating with our emergency use authorization from the FDA in December, we had vaccinated this many people in the trials, right? However many 100,000 or what number they use. And we have come so far from there. We have so much more data than we had when we did our emergency use authorization. Hundreds of millions of people have been vaccinated now, and we have far more data than the emergency use authorization requires or even expects. And like Rosie said, Pfizer, and I really believe Moderna too, are already submitting paperwork for their FDA approval, because we've collected enough data to show that these are viable vaccines and safe vaccines.
Also, in concerning the statements that people make saying that the vaccine kills people. We have a comment. Kimberly Fontano, she says it. I've worked in pathology, autopsy. Not one autopsy has said anything about COVID vaccine being the cause of death. She said it's most likely an underlying uh, condition, and
Mhm.
a lot of times the people who pass away after getting vaccinated, they had already had the virus in them, and the virus itself aided in the cause of death, not the vaccine.
Yeah, because the thing about it is a virus can only work and matriculate through a community with a living host. So it can't move. And that's one of the things, that's the reason why the Delta variant has become so prevalent. Had we vaccinated enough people in the first go around when we didn't really have the Delta variant as a issue of concern or worry, it can't grow and manipulate if it doesn't have opportunities to grow and manipulate. If you're vaccinated, it can't get into you, so therefore it can't, adjust and change the spiky protein. So that's one of the things, like when we talk to our people in contact tracing, I said, hey, how do I talk about possible breakthrough cases for vaccinated people? And how do we really educate those folks? It's really because, again, and I know I sound like a broken record, the less opportunities it has to grow and mutate, the less opportunities it has to grow and mutate to infect people. And also, what we've learned, like I do the mobile vaccine. So we don't have a brick and mortar clinic. We go out into the community. So we have a team at Food Town at the grocery store. And with our contact tracing data, one of the things that we kind of knew maybe we were doing the right thing, where they showed one of the number one places folks were infected was the grocery store. So I said, well, at least we're there. When they do the contact tracing, they were at grocery stores, restaurants, or mass gatherings, parties, things like that. Because when we do the stuff, we ask you where you've been, so we can know where there's surveillance. But one of the things that we tell people is make sure that you get vaccinated, make sure that you are safe, make sure you have your mask. And if you have underlying issues, just like the comment was said, why would you give the virus weakens your body, weakens your immune system. So if you already have issues, it just makes it easier for whatever those issues are to affect your system.
And if you don't mind, if we could talk for 1 second about vaccine safety monitoring too. I appreciate that comment so much. And I feel like that's probably information I'll continue to share, because that's a great insight from a person who is really dealing with deaths related to COVID. And so thank you for that comment. But these vaccines are being very closely monitored through different systems. So when you get your vaccine, you're asked to sign up for a VSafe safety survey. They text you information to your phone, a little survey periodically. And you just tell them how you're feeling after your vaccine, if you're having any concerns or problems. They also ask if you're pregnant and closely monitor your responses if you were pregnant when you got vaccinated or if you became pregnant after your vaccine. So they're monitoring all of that information too. We also have a VAERS system. It's a vaccine safety reporting system that an individual in the community can report to, or especially medical professionals too, if they notice something. And so providers have been instructed that if somebody's been vaccinated and then for some reason they die, that's reported to that system so that all of those things can be monitored. And they haven't had any indications that the people who have been reported to that system have had deaths caused by or related to their vaccines. And like your commenter said, some of those things have been related to COVID exposure and then being COVID positive before they were vaccinated. but it's not related to the vaccines.
Okay.
Yeah.
Now, I was on both sides of the fence. For a while, I was kind of, Brandy, I told you I was kind of on the fence about taking the vaccine. I wasn't so like opposed to it, but I was just skeptical about it because of some of the things that I had heard too. And Brandy, I just recently got my vaccine, well, the first shot, and
Yeah, I was proud of you. You did good.
So, and people are asking me like, well, how do you feel? I was like, well, I feel fine. I had like minor stuff like a headache or whatever, but who doesn't have a headache here and there?
Mm-hmm.
And and I have underlying health issues. So, coming from a person that has been on the other side of belief in this vaccine, I think that like my pastor says all the time, I mean, it's better to have it and not need it than to need it and not have it kind of situation. So it's better to get it because, I mean, why not just be safe? And also, it also made me think about, I don't go around a lot of people, a lot, but I don't think you have to go around a lot of people to get COVID. I mean, it could come where you are because,
Okay.
even people that live with you could go out and bring it back. And so I just felt the need to protect myself and the people that I love as well. And that's one of the things I wanted to push out there to people is to let everybody know that, if you're skeptical about it, ask questions, but don't listen to the hype. That's because there's too many people that's listening to the hype that's not get vaccinated. And so that's one of the purposes of this show with you guys on is to try to encourage people to get vaccinated and to explain what the vaccination is, first of all, and to tell people it's not filled with nanotech. Because I mean, if it was filled with nanotech, then what? Gia, we was talking about earlier, like
Yeah, I
after they
mean,
put nanotech in us, then what? We're
then
gonna
what? Then what
become
they're gonna do?
cyborgs or robots or something?
I mean, it's not like we don't have cell phones where where we're constantly could be tracked. There's
Yeah, money
there's a
all the
whole
time.
GPS system in here. So to
Yeah,
me,
I get in my car and it knows where I was last time. And it says, "Oh,
Right?
it looks like you're going there again."
yeah,
Oh no.
Well,
So
I told one guy at an event, we were at a concert, and he says, well, they're gonna chip me. I said, what we really need to be um, concerned is on why you're worried about being chipped. Like,
that is a
well,
good
how
point.
are you moving in the world where being chipped is a concern? That
what are
really
you
is
doing
more
in the
important.
dark, right?
And you know what he said? He said, you're right. Why would you need to be chipped? Do you have a secret that we don't know?
Yeah.
That's a
I
good
mean,
point
everyone
right
is
there.
important, but
Yeah. So this is another question I have, and there's a lot of misinformation about the vaccine in older people. I know we've kind of mentioned it a little bit earlier in the stream, but like when I was telling people my 94-year-old grandmother got the vaccine, they were like, "Oh my God, is she okay?" And my grandmother is fine. Like nothing has changed. She didn't even have any like bad reactions from the vaccine. But that was like I'm pretty much everybody in my family. Like I didn't have like when I got my 2 shots, I got the Pfizer shot. I didn't skip a beat. But I'm like normally healthy as an ox, so I could kind of understand it, and like that's why I kind of like I throughout the whole entire pandemic, trust me, I wore my mask and stuff like that. But like Archie, like my co-host, I was a little skeptical. But once I started seeing everybody in my family get it, and then unfortunately with my friend, it was just kind of like a no-brainer. It was just like I'm gonna get it, and then once I got it, I didn't have any adverse side effects. I was like, well, I don't know what the whole hype was like. It just,
it's
it just
but it's a fear. It's
yeah,
a fear thing.
Hmm.
And remember, I think it was God, was it Will Smith or somebody made a quote about like it's no more dangerous now than it was in previous generations. It's just that we have more access to it or more information. We can see it more, right? So when I was in school, I'm dating myself, but I can remember where I couldn't just get on the internet, or I had a dial internet where you got on stuff and things like that.
AOL.
Yeah,
AOL.
I could. We
You
were
got
joking
that.
about having my MySpace, which are top 5 and things like that. So for as much information you're exposed to more propaganda, more negative things, more opportunities for misinformation. Like I see in the comments, the young lady says a major issue is spreading misinformation.
Yes.
Which is why people like Brandi are super important, because our outreach people are trained by her. She teaches them how to go into the community and give them reliable, factual, scientific data. It's a reason why people who work in clinical areas, they don't, there is no absolute in science. It is an ever evolving and changing thing. Like, I'm a nurse, so I practice nursing. A physician practices medicine because the physician they were when they became a doctor and the physician they are 10 years later, science has evolved. This vaccine has evolved. The virus has evolved. It's
Yes.
merely making yourself a student of reliable information.
Here's what I have to say about the conspiracy theories is that a conspiracy theory is called a conspiracy theory because it has not been proven.
Right.
So people with the conspiracy theories who's listening to that, they need to compare that with the actual facts because a conspiracy, if you just go and run with a conspiracy theory, you could be running with a total lie.
Mhm.
So and you continue to be misinformed. So people have to realize that a conspiracy theory is not factual. It's
Yeah.
going to continue to be a theory until it's proven to be true. And so, with all the theories that's out there, none of us are proven to be true. Why still listen to
It's just, people believe a lot more than the truth sometimes.
them? Unfortunately, that is true.
Here's what I concern myself about is that um, I would hate to be the person that told somebody, oh, you shouldn't get vaccinated. It does XYZ thing that I saw on the internet. And then something terrible happened to that person, COVID related. They catch COVID, they have a significant outcome from it. I would feel terrible that I told that person not to protect themselves and not to keep themselves safe when they could have been okay. So I'm very mindful of the information that I share. I make sure I don't just share pro vaccine information for the sake of it. I really read about these things, and anytime somebody tells me something that I haven't heard, or I don't just say that doesn't sound right, it's probably not true. I take that information back to my desk and read about it, because I find that everything that somebody says that is against the vaccines that I've found so far has been based in a nugget of truth that was twisted around. And so I find whatever nugget that came from. I like, my favorite question to ask somebody who is against getting vaccinated is, I ask them why. And then when they give me their reason, I say, could you please share with me where that information came from? And so then I go back and read about that information to make sure that I understand what their concern is. And what I found is it's usually based in a nugget of something that really was true, but just misinterpreted. And so it's really important to inform yourself with reliable information. And so before you take something at its word, before you take my information at its word, I would encourage you to go read about it and make sure that you believe the things that I'm saying and that Rosie's saying, but do also trust that we have done a lot of research and that we would make sure in a responsible manner not to share information that wasn't safe for people.
Yeah, and you know what I like to add, like if you are a person that don't believe in the vaccine and you know the real facts about it, and you just choose to not get it. My thing is, don't try to make everybody else side with you. If you choose to not get it, you choose to not get it on your own. But let everybody else make their own decisions without being influenced with the negativity.
I agree. Sometimes this is an act of service. Sometimes sharing your story, I think also, and not create a stigma on those people that are unvaccinated because we really, really need them to get vaccinated. They're really the unvaccinated population right now is the key to getting on the other side of this virus. So I really kind of worked really hard not to stigmatize or judge people who haven't gotten vaccinated. I have a couple of family members that I've literally been begging, and today, right before I came in here, all of a sudden they wanted to get vaccinated. They're like, "Hey, where are you at sites at this weekend? Are you going to be there? Can you give it to me?" And stuff like that. Because if you meet them where they are, give them reliable information, and stay consistent too. Don't get a part of the hype. Don't get political. Just make it about the facts and take care of people. um I just maybe I'm a eternal optimist. I just really feel like if we put enough good out, we'll get people vaccinated.
Yes, absolutely.
So, this is a question I have. What about, because we already have people who are very skeptical about the vaccine. You're gonna have people who are skeptical about the boosters. So we don't even have any boosters yet, but do like can y'all tell us a little bit about boosters if they do come out, or like a time frame if we don't put a handle on COVID?
I don't think we've been cleared for boosters. I know that they are doing studies and data on that, but I fully believe that the people who got the first wave of vaccinations will be open to getting a booster if needed. It'll probably be for your high risk special populations, just like it was a tier phase the first time. It'll probably be a tier phase the second time. But people need to understand that we already do boosters in various vaccines now. We give the flu vaccine yearly. As a healthcare provider, had multi vaccines for the hepatitis B, tetanus. We have vaccines for that. It's a window of immunity, and if you pass that window, we revaccinate you to build up your immunity. It's not. I One of the things I try to communicate is a booster would not be something rare or out of the ordinary if needed. But if we can get enough people vaccinated, those things may not be necessary. Also, again, to Brandy's information, where she talked about the timeline of the vaccine and it is matriculated and grown. I got vaccinated some time ago. So, a person like me who's in a high risk uh, job title where I'm around people, a lot of people, whether I want to be or not, right? Somebody like myself will probably have to get a booster in order to maintain immunity to protect myself and to protect the clients that I serve to make sure that I have a baseline of immunity. So there's certain things that are booster needed based on your occupation.
So you guys see the comment from Wholesome Granny?
Granny.
Y'all wanna address that? We're sorry, Wholesome Granny. It's a funny name, so
Yeah.
um
How
so
many jabs of the coronavirus vaccine does it take before you're safe from the coronavirus? The world may never know. Um, I firmly believe, to wholesome granny, that a vaccine is better than none. So the road to that would be one.
well, there you have it.
Yeah. Some people are going to be facetious, and my whole problem is, you have people, and we're not going to drop any names, but you have people who are like on television day in and day out, and you even have politicians on television day in and day out, you know, ramming this disinformation down people's throats about the vaccine, but yet on the back end, behind closed doors, they're getting vaccinated. And you have these people who are dying. I know there was this guy who was he had got COVID, and Steve Scalise, I think, from Louisiana, he had changed his mind and got the vaccine, and they were like, "Well, your senator got the vaccine. How do you feel about it now?" And he said he said it was fine, but you could tell deep down, like he was like, "What?" He's like, you turned your back on me, you know. And there's just so many people like that, and you know, it's disingenuous, and that's why I know when I got my vaccine, I posted a picture of it, not to, you know, try and brag, but just to show like, hey, I'm comfortable enough to get it. You know, this is, you know me, you know who I am. You know, you can call me up and have a conversation with me. And I got my vaccine, and I'm not dead. I'm not dying. You know, nothing has changed. There was no adverse side effects. So, you know, it's just, you know, really just trying to defeat that disinformation out there.
Yeah, that's what we need. That's exactly what we need right now. Um, so that's one of the things that you know, Brandon, me and you talked about is that, like I said before in the show, that messaging to those who have been misinformed is very, very important. And one of the things that people can look at is those who they know personally who has been vaccinated. Look at the proof. I mean, look at what you can see. Um, because, like, you know, Gion, you've been vaccinated. I've been partially vaccinated, and as soon as
You're
it's
on
time
your
for
way.
my second shot, yeah, I'm gonna go get the second one. And you know, you just have to believe in it, and stop thinking that it's bad. What's wrong with people? I just don't get it.
Well, and we talked about the other day that unfortunately, this is a public health emergency and not really a political issue. And this has been, the more political it's been made, the more divisive it has been for people. And that's unfortunate because really this is a health issue, a public health emergency. And this is, rather than a time for us to find ways to disagree, this is a time that we need to come together and take care of each other and protect each other. And so it's unfortunate that we've had that kind of messaging from the very beginning, because we really need each other right now more than ever.
Yeah.
This is more of an act of service. To get vaccinated right now because of the pandemic status and the way the world is going. And unfortunately, this wave is really, we're like in the fourth wave now. This is a really good way. I remember the Immunization Bureau, when we first started doing this, had these posters where you shared why you got your vaccine. And it was really awesome to hear people's whys. One of the things that we do when we have people that come and work at the health department is we ask them, why are you here to work? Because this is not a field where you will get really rich, but you will get really rich in experience. I never question why I'm here. And that's why it's necessary and important to make sure that we have folks like you guys to give us an avenue or a venue to kind of just communicate and understand that the majority of the people that are servicing the community looks just like them. We're moms, we're sisters, we're dads, we're brothers, we're somebody's son, nurses, community workers. We have to understand that this virus doesn't care what you look like or where you come from. It's affecting the entire world. Doesn't care what political party you're in.
That's right.
Or how much money you have.
Or
That's right.
it could care less that you have money.
Here it is. Maximilian's Boutique asked, what is the long-term effect, I'm assuming, of the vaccine?
You have immunity to the coronavirus.
Exactly.
Yeah.
That's exactly right.
That would be, but if he's asking about it's a condition that you can have when you are COVID positive, and once you come on the other side of that, called long haulers effect with the coronavirus, and sometimes you're just never really quite the same. You could have been running miles, and now because of the permanent damage that the coronavirus has done to your body, you have long-term effects based on how your body fought or handled the virus. So it could be two things.
Can you, Roselynn, can you please talk a little bit about that? Because that, to me, that is so, that's just a reason to get the vaccine in and of itself. these long haulers who still have the effects of COVID way
Mhm,
after they have the
mhm,
virus. How like
mhm.
what does how does your body transform into that? Like what does COVID do to make your body like just turn to that?
So normally viruses don't necessarily kill you. You die from the complications of a virus. And this is not necessarily specific to the coronavirus. But in this situation, I tell people three ways that it can affect you. So let's say you get really, really sick from COVID. And in that, your lungs, your heart, and your kidneys are all working organs. They all work together. So when your lungs which is normally it's a respiratory virus. When your lungs get full with fluid or mucus or things from the coronavirus, that makes your kidneys work really hard. So let's say you were intubated and you are on a breathing machine. That means your kidneys had to work a little bit harder. So sometimes people have end-stage renal disease or have renal disease. That's one thing. So therefore, that would be a long-term effect. Two, it could be a heart thing. So your heart sits. People think it sits like here, it doesn't. It sits in between your lungs. So if your lungs, and you think about something really soft becomes really, really hard, like cheese when it's hot and it's movable.
Mhm.
When it becomes hard and it's there, you can't breathe in and out. So also that affects your heart. It affects how it pumps. So because everything works this way. So unfortunately, it can mean some people tend to have heart attacks. And then you have the long-term residuals from those kind of things. So I've talked about your lungs, I've talked about your heart, and I've also talked about your kidneys. Sometimes those things may not be as drastic as that, but you just sometimes don't get all the way better. So you're never right at a threshold where you were before you were infected. And those kind of things can create some long term effects. You may have never had asthma before, but now you do. You may never got it wounded before, but now you do. If you can get a vaccine to prevent those symptoms, it can help. I mean, fiscally, it can have some long term effects. ICU stay is a very expensive um, stay. So financially, this can affect you.
Okay, we have someone asked a question. This is actually Maximilian's boutique. This is actually my sister. Um, she
Hi,
says,
sister.
how long should you wait to get vaccinated after you've had COVID?
I want to say it's 10 days or 14 days, right, Brandy?
Yeah, the problem with getting vaccinated and being COVID positive is not that the vaccine will be dangerous for you because you're COVID positive. The problem is you don't want to infect all of the people at the vaccine site. And so it's usually about 2 weeks. So you want to make sure that you're not going to be exposing the public to COVID when you go to get vaccinated. You want to make sure to quarantine while you're sick. And when you're no longer sick, then by all means, go get your vaccine.
Um,
Okay.
she also asks, "Is it in the air?" So I guess she's asking, "Is it airborne?"
Um, so I'm leery of saying it because as it sits in the air and the distance, so that's the whole concept of the social distancing. So technically, yes, it's in the air, but for a certain time frame at a certain distance. That's why the mask and the social distancing matter. But the Delta variant is more contagious than the original variant that we had. So those kind of studies and things like that. So that's why with the distance and the masking, and even when we have nurses that work in the environment, as we were vaccinating our teens, we had N95 masks to protect you from the airborne particles.
Um, Gion, could you read that the comment from Lawanda?
Okay. Can you address the situation with our kids and schools not wanting to mask some districts, masking others, others, but I'm trying to
Not,
see. Yeah, okay, but not at risk of all kids not being vaccinated. I was trying to see where that at risk or at risk part was going into that question.
I think maybe she's asking about different school districts not necessarily mandating masks for children. I think.
I think that's the gist of it.
Well,
We can
we,
share for sure that the CDC recommendation is for schools to mask and social distance. As things, so CDC is like a national recommendation, and as things drop down through more local systems, some of those things change, and some of the schools have the right to choose certain things for themselves. But we do know that the CDC recommends masking and social distancing for students and teachers. And so please do encourage your individual children to be proud of their safety measures. And even if their friends aren't masking, and even if their teacher isn't masking, that it's still okay for them to do that and to be proud of themselves for making a safe decision.
Oh, there's a couple more comments, Gion. If you could see them, I can't see them that good.
I can't. No, I just see one lady, Latoya Williams. She was talking about how she got the vaccine recently and how she felt fine, and she has health issues, and she was skeptical about it at the beginning. So just just another testimony to someone saying they were skeptical, they have health issues, and they gotten it, and just no problems at all.
Yes.
But so I don't want to keep you ladies, but I do have like one final question. Where do y'all see us? And I know y'all can't, I know y'all can't tell the future, but if we were to look into a crystal ball, and let's say we don't hit that 70% mark of people being vaccinated, what does it look like in a year? Do the deaths continue to spike up? Does it just continue to mutate? What does the future hold?
I hope not. I really hope not.
Well, I personally, as an individual, am personally very concerned about this current uptick in cases and about this Delta variant. Like we mentioned earlier, yesterday, Harris County went back up to a risk level red. And that's the highest risk level. We're at the highest amount of risk we could be at for contracting and spreading COVID. And so I am concerned that the next couple of months may be very hard for us. And I do just really hope that people will go ahead and get vaccinated. I'm so excited for Miss Latanya, and I hope that you will talk to your friends and family and community members and spread the word about your very good outcome and your very safe choice you made. Because I feel like if we don't get out there and get vaccinated, the next couple of months can be very difficult for us.
Okay. And I'm actually kind of optimistic. I don't think that it's going to be bad next year because I'm seeing more people come get vaccinated. We had some operations when we started this community vaccine clinics where we had days where we only gave 10 vaccines and we were around hundreds of people. And now I'll give you these past couple of weeks. 3 weeks ago, our operations, which is relatively small, saw about 500 people in those 7 days. Then the next week it was 1,000. We're still not even into the weekend and we're already at 1,000 today. So, and it started on Tuesday. So, I think next year we'll hopefully be better. We'll be safer. We'll be more vaccinated. I am praying that we are able to vaccinate our small children before school starts, and that we just continue to fight the fight. I think if we have people like you and people like Brandi and myself pushing real good doctrine out, I think we're going to be better and safer next year.
Okay.
Yeah.
Okay. We that's what we hope anyway. So we're going to keep pushing the message out, and we definitely want to encourage people. And if anyone's watching or know someone else that has not been vaccinated, then maybe tell them if you haven't been vaccinated, don't live as though you have, because you can spread it. You know.
Yeah.
Yeah.
Can I put, Brandy, do they have the information to where they can make an appointment? Maybe we can put it in the chat.
That'd be great to put in the comments.
Yeah, I'm gonna put that in the comments so they can see.
Yeah, and then we want to
And we
also
can put
add
it
this to our descriptions.
exactly. Just
Yeah.
word straight out of my mouth.
In fact, all of your any kind of contact information you guys want people to be able to see and utilize, then just give it to us, and I'll make sure we put it in our description.
And we update this website every day. So it has all of our sites, all of our initiatives where you can go in the community. And also, I'm going to put in the appointment number information in the chat to ensure that we have both of those. This is information, and you can make, and you can do self-appointed appointments. There's information. And I will do a small plug. The Immunization Bureau is giving community vaccines and COVID vaccines at multiple HISD schools this weekend. We're moving to have our Super Saturdays. And then we've given vaccines in the clubs, at the festivals.
Everywhere.
Yeah, we've been to Prospect Park. We've been to Five Central. We've gone Turkey Leg Hut. We do flea markets on the Saturdays and Sundays off of Airline. We go to amusement parks. I tease and say we go on the highways and the byways.
Yeah, I mean, y'all came to my church, so that's where I met Brandi. So yeah,
Which church?
Living God, non-denominational church. Yeah.
Awesome.
I'll just say,
I think we got quite a few vaccinations down here, huh?
I'll just say you guys have a great vaccination rate. Y'all guys, you're doing good things.
Woohoo!
Good.
Yeah.
That's awesome. I like to hear that.
Yeah, I think just about everyone at our church is vaccinated. Just about.
Awesome.
Good.
Part of the Back to Church initiative.
Yeah.
And Miss LaWanda said, "Thank you for your service in the community."
Oh, thank
To the
you.
guys.
We're glad to help. We hope that this information is spread. We only can talk to so many people, and all of your listeners can really help us reach people who need to hear this message.
Absolutely.
Exactly. Definitely. And we definitely want to we're gonna put y'all information in there so people can ask questions and further dive, pick y'all brains, and y'all could, give, exact information to exact questions, because there's a lot of misinformation, and you want to hear from the experts. And we just really thank y'all for coming on and giving y'all a platform so y'all can give some information to the community that's greatly needed, because we want to get back to normal, and that's what we're all striving for. And the vaccine is just one step, probably the biggest step we can take to getting back to normal. So I just really thank you, Miss Rosie and Miss Brandi, for coming on the show and just taking time out of y'all busy days to just inform everybody and just let everybody know how safe the vaccine is, and just get rid of some of this misinformation and things of that matter.
Thank you for having us. We appreciate y'all letting us share our information.
All right.
Absolutely.
So, guys, that's our show. Don't forget to like, comment, and subscribe. Hit that notification bell so you don't miss out on any uploads. Also, you can find us anywhere where you can listen to podcasts. Thank y'all. Y'all have a blessed day.
Thanks.